What is a nervous pregnancy? Pervasive pregnancy or pseudocyesis is a psychological disorder that can affect women, regardless of their mental health or family situation. Find out more in this video. Have you ever heard of pseudocyesis, also called nervous pregnancy? It is a psychological disorder that usually occurs in women between the ages of 20 and 40. Although there are known cases of young girls and postmenopausal women with this problem. Find out more about nervous pregnancy, the reasons for its occurrence. What is a nervous pregnancy? Pseudocyesis is the medical term for false pregnancy. In other words, the belief of a woman to be pregnant when in reality she is not. But what exactly is a psychological pregnancy? This disorder, also called Rapunzel Syndrome, is not just a thought or a feeling. It is about the true conviction of being pregnant, which manifests itself not only on an emotional level but also physically. Indeed, the body acts as if there really exists a fetus in gestation. Causes of a nervous pregnancy. Pseudocyesis is believed to occur through stimulation of the neuroendocrine system by psychological factors. Among them we find feeling lonely or wanting to be a mother, severe depression, low self-esteem, belief that, without a child, the husband or partner will abandon it, social pressure to be pregnant, extreme fear of getting pregnant, situations of sexual abuse in childhood or adolescence, emotional stress, infertility, the fact of having suffered from one or more miscarriages or the death of a child, approaching menopause and desire to have children. Symptoms and diagnosis. The incidence of utopian pregnancies in the population is low. It is estimated that 1 in 22,000 pregnancies is psychological. Now let's find out the symptoms of this disorder. Missing periods. The hormones LH and FSH decrease so that the woman does not ovulate and the menstrual cycle freezes. The onset of fatigue, feeling of nausea, or even vomiting. This is due to an increase in prolactin and progesterone, increased tenderness in the breasts, belly growth, the sensation of fetal movements in the belly, milk production, contractions. If the disorder is left untreated, the pregnancy, although psychological, will continue its course, including the growth of the belly, the sensation of the baby, kicking, and the pains of childbirth. As you can see, the mind influences the body by generating an organic or psychosomatic reaction, in which hormones are altered and symptoms equivalent to those of a real pregnancy occur. For this reason, it is necessary to establish a diagnosis. Examine the woman. Request a lab test. A urine or blood test will indicate the dosage level of the hormone BHCG. A negative test indicates the presence of a nervous pregnancy. Do an ultrasound. The absence of a fetus in the uterus makes the diagnosis obvious. The woman suffers from a psychological disorder that must be treated as quickly as possible. If the woman is producing milk, then it is essential to perform tests to rule out the presence of a prolactinoma. In other words, a tumor in the pituitary gland that could stimulate prolactin, the hormone responsible for the production of milk. Treatment of nervous pregnancy. The doctor will indicate the most suitable treatment according to the physical and emotional condition of the woman. As a rule, he recommends a psychological consultation because it is a disorder of psychosomatic origin. Finally, pseudocyesis is a psychological disorder that can generate some shame in those who suffer from it. If this is the case with you, be aware that you are not to blame for what is happening to you. Trust your doctor and family to get through this ordeal.